Hi, my name is Ashley. I'll be the PA student taking care of you today. We're going to be doing the neurologic exam while I go wash my hands. Can I have you take your shirt and then shoes and socks off? Thank you. So starting off, I would perform a mental status exam at this time. I'm going to move on to the cranial nerve exam. So I'm going to first have you occlude one nostril for me and take a deep breath in and out, and then occlude the other nostril now and take a deep breath in and out. I want to test nasal patency before I start testing cranial nerve 1, which is the olfactory nerve. So I'm going to have you close your eyes now and occlude a nostril. I want you to tell me what you smell.
Coffee.
Scent. Perfect. Now I want you to occlude the other nostril now. I want you to tell me.
Cinnamon.
Okay. I'm going to move on and test cranial nerve 2, which is the optic nerve. I'm going to test near visual acuity, 14 inches away with the Rosenbaum chart. So I want you to hold this right here for me. I want you to cover your left eye for me and read the lowest line with your right.
4, 2, 6, 7, 3, 9.
Okay, and now I want you to switch sides and cover your right eye.
4, 2, 6, 7, 3, 9.
Okay, and then now with both eyes open.
4, 2, 6, 7, 3, 9.
Okay. In addition, for cranial nerve 2, I'm also going to test visual fields by direct confrontation. So I'm going to have you put your hands in a fist. I'm going to wave my hands around. I want you to point up when you see them come in your vision. Okay, I'm going to test cranial nerves 2 and also cranial nerve 3. So I'm going to get my pen light to test direct and consensual pupillary light reaction. So I'm going to shine it, direct, consensual, and then switch sides. Direct, consensual. In addition, I'm going to test for accommodation, and that test goes with cranial nerves 2 and 3. So I'm going to have you look at the window, and then now I want you to focus on my pen light. Okay, I'm going to move on and test cranial nerve 3 and also cranial nerve 4, which is the trochlear nerve for convergence. So I want you just to look at my pen light as I move it towards you. Okay, moving on, I'm going to test cranial nerves 3, 4, and also cranial nerve 6. I'm going to do the extraocular muscle movement. So I'm going to have you be 1 arm's distance away. Perfect. I want you just to look at my pen light as I move it. I don't want you to move your neck, okay? So just your eyes. And when I'm doing this, I am inspecting for any nystagmus. I forgot to mention earlier when I was testing for visual acuity that I would do the distant visual acuity with the wall mountain Snellen chart from 20 feet away, but we don't have that in this room right now. I'm going to dim the lights now for the ophthalmoscope exam. I'm going to turn on the light and make sure the diopter works. I'm going to stand 4 to 6 feet away to check the corneal light reflex for symmetry. Okay. Going to move closer, 15 inches. I'm going to get check for the red light reflex. And then I'm going to inspect for the optic disc margins, the cup to disc ratio, the retinal arteries and veins, and the condition of the retina. So just keep looking over there. And now I want you to look into the light. I'm going to inspect the macula and the fovea. And then I'm going to repeat it on the other side. So, 2, and then now look into the light. Okay. I'm going to turn this off now. We can turn on the lights, please. Thank you. I'm going to move on and test cranial nerve 5 and 7, which are the trigeminal and the facial nerves. I'm going to test the corneal blink reflex. So I want you to keep your eye on my finger. I'm just going to, okay, and now look on this side. Okay, I'm going to now test cranial nerve 5, which is the trigeminal nerve. So I'm going to have you clench your teeth, just going to palpate the temporalis and the masseter muscles. In addition, I'm going to get my cotton ball back. I'm going to test for light touch sensation, which tests for cranial nerve 5, the trigeminal. There's 3 branches, so I'm going to have you close your eyes for me. Does this feel the same as this?
Yes.
Okay. Does this feel the same as this?
Yes.
Okay. Does this feel the same as this?
Yes.
Okay. Moving on, I am going to now test cranial nerve 7, the facial nerve. So I'm going to have you raise your eyebrows for me. Okay. I want you to frown. I want you to show me your teeth. I want you to smile. Puff out your cheeks. I want you to pucker your lips. And then whistle if you can. Okay, moving on, I am going to test cranial nerve 8, which is the vestibulocochlear nerve. So I'm going to cover one ear and whisper a word. I want you to repeat it back to me. Football. Okay. Cupcake. Okay. I'm going to move on with the exam and test for the gag reflex, which tests for cranial nerve 9, which is the glossopharyngeal, and then cranial nerve 10, which is the vagus. I'm just gonna mimic it, so I would just open up and just touch it in the posterior pharynx, but I'm not gonna do that bilaterally. I'm going to now test cranial nerves 9, 10, and 12, which are, 12 is the hypoglossal nerve, so I'm going to have you say ah. Okay, in doing so, I am just inspecting the soft palate and the quality of the patient's voice and speech. I'm gonna put this down. Moving on, I'm going to test cranial nerve 11, which is the spinal accessory nerve. So I'm going to put my hands, I just want you to resist. So try to raise your shoulders, okay? That was the sternocleidomastoid. I'm going to put my hand here, turn your left, okay? That's the trapezius. Okay, moving on, I'm going to test cranial nerve 12, which is the hypoglossal nerve. So I'm going to inspect, I guess, make sure that her tongue comes out, and is it symmetrical, not like in the midline. I'm gonna make sure I can move left and right, and then, okay, just open, move it left and right. Want you to press your tongue on the inside of your cheek, and just, there we go, and then the other side. Okay, and lastly, I'm going to test for lingual speech, so I want you to repeat the phrase, no ifs, ands, or buts.
No ifs, ands, or buts.
Okay, and that was the end of the cranial nerve exam. I'm going to move on to the motor part of the exam. So I'm first going to inspect the upper and lower extremities for muscle bulk and atrophy, and then followed by muscle tone. So first the inspection, then muscle tone. Similar to what I did before, I'm going to put my hands on. I just want you to resist my movements. Okay, so for shoulder abduction, T5, C6. Shoulder adduction, C6. Okay, I want you to put your arms out like this. Try to bring them towards you for elbow flexion, which is C6, C7, and then elbow extension, C6, 7, 8. I want you to put your hands out for me. Wrist flexion, so C6, C7, and then wrist extension, C6, 7, 8. I want you to grab onto my fingers for hand grip. Okay, so that is testing for C7, C8, T1. I want you to pull your, I'm gonna try to resist. This is testing the ulnar nerve, C8, T1. And then thumb opposition, I'm gonna try to break them open. That's also C8 and T1, but the median nerve. Okay, moving on, I'm going to now do the lower extremities. So I'm going to try to have you, I'm going to do the same thing. Put my hands on, once you try to resist. Hip flexion, L2, L3, L4, and then hip extension, L5, S1. Bring them outwards, L4, L5, S1, and then inside. So that's hip abduction, sorry. And then inward is hip adduction, so L2, L3, L4, perfect. Moving down, I want you to try to bring your legs out. So that is L2, L3, L4. That's knee extension. And then bring them back. So this is knee flexion, L4, L5, S1, S2. Okay, now I'm going to try to bring your toes up. So this is ankle dorsiflexion. This is L4, L5. And then plantar flexion, and that's S1. And then I'm going to do the great toes on each side, extension. You know, bring them up. That's L5, I believe. Okay, moving on, I'm going to test for light sensation. So I'm going to grab a cotton ball. I want you to close your eyes for me. And then I'm just going to wave it around. So I'm going to do C5. Does this feel the same as this?
Yes.
Okay. Can I have you actually have your arms out a little more? Perfect. Thank you. You can close your eyes again. Does this feel the same as this?
Yes.
Let me just repeat that. It should be all the way to the thumb. That's C6. C7, does this feel the same as this?
Yes.
Okay. And then C8, does this feel the same as this?
Yes.
Okay. T1, does this feel the same as this?
Yes.
Okay. And then T4, does this feel the same as this?
Yes.
Okay. T10, does this feel the same as this?
Yes.
Okay. And, so this is L2 now. Does this feel the same as this? I would do it under clothing.
Yes.
Okay, perfect. Now L3, does this feel the same as this?
Yes.
Okay. L4, does this feel the same as this?
Yes.
Okay. L5, does this feel the same as this?
Yes.
Okay. And then S1, does this feel the same as this?
Yes.
Okay, I want you to keep your eyes closed. I'm going to grab one of your hands. I'm going to test for position sense. So I'm just going to wiggle your finger. I just want you to stay relaxed. At the DIP joint, is your finger pointing up or down?
Up.
Okay, I'm going to do it on this side. Wiggle, wiggle, wiggle.
Down. Up.
Okay, I'm going to move down here to your toes. Sorry if you're ticklish.
Up.
Okay.
Down.
Okay. With your eyes closed still, I'm going to put something on your thumbnails and your toenails. I want you to tell me if you feel vibration or pressure. Just testing for vibration sense. Ready?
Vibration.
Okay. Ready?
Vibration.
Okay.
Vibration.
Okay.
Vibration.
Okay. Moving on to the well, now I'm going to test. So I'm going to test for stereognosis and graphesthesia. So I'm going to have you keep your eyes closed. So I'm going to put an object into your right hand. I want you to tell me what it is.
Paperclip.
And then now in your left hand, what?
Cotton ball.
Okay. With your eyes closed still, I'm going to draw a number on your hand. I want you to tell me what it is.
2.
Yep.
3.
Okay. Moving on now, I'm going to start the reflex test. So I'm going to put here the biceps, which is C5, C6. Find it right there. You can just relax a little bit. Okay. Now on this side, relax. Okay. I'm going to move on to the brachioradialis. So I'm going to put her hand there. Okay. And then now this side. Okay. That was C5, C6 if I didn't say that. I'm going to move on to the triceps, which is C6, C7. So I'm just going to position your arm. I want you to relax for me. Ready? Okay. And now this side. I'm going to have you relax for me. Go. Okay. I'm actually going to have you now lay down for me. I'm going to test the abdominal reflex. Thank you. So we're going to do T8, T9, T10. I would do this under clothing, but T11, which is under the umbilicus, and T12. Okay, perfect. I'm going to now have you sit back up for me. I'm going to move on and test the patellar reflex, which tests L2, L3, L4. So I want you to look the other way for me. Okay. This side. Okay, Perfect. I'm going to now move to the Achilles tendon, which is testing S1. So I'm going to slightly dorsiflex the foot right there. Okay. And on this side, and switch hands. So dorsiflex. Okay. I'm also going to move down and test the plantar reflex. That's testing L5S1. So I'm going to just go. Sorry, I'm gonna just raise it up a little bit. Okay. I didn't say, but you just go basically outer to inner. And while I'm down here, I'm going to test for ankle clonus. So I'm just gonna wiggle and tap, wiggle and okay. Moving on, we're gonna test the cerebellar function. So I'm gonna have you, it's called the finger to nose test first. So I'm gonna have you use your index finger and use it to touch my finger and then back to your nose. Perfect, keep going. And then I'm just gonna move my finger. I want you to keep doing that. Should be going up, here we go. And now with your eyes closed, I want you to try to touch my finger, okay? And now on the other side, you do the same thing, perfect. And then here we go. And now with your eyes closed, it's okay, sorry, perfect. Okay, so I'm going to now have you do heel to shin. So I'm gonna have you use your heel and rub it from your ankle up to your knee, back down. Okay, and then the other side. Excellent. Okay, now we're gonna move on and test rapid altering movements. So I want you to pretend you're screwing a light bulb, wiggling your hands, and then I want you to tap your feet. Okay. Now I'm gonna have you stand up for me with your feet together. So I'm just gonna check her stance and she's not falling over. So I'm gonna have her put her arms out like this and close her eyes. I'm going to test Romberg, which is just me observing for 30 seconds, and also pronate or drift, just to make sure that her arms don't fall down while her eyes are closed. Okay, now you can open your eyes for me and lower your arms. I'm gonna have you now walk to that chair right there, like you normally would. When you get to that chair, I want you to turn around and walk like you're walking on a tightrope. So one foot in front of the other. Perfect. When you get to me, I want you to go back to the chair, but walk on your tippy toes for me. Okay, when you come back, I want you to walk on your heels. Perfect. And then the last part of the exam, I want you to try to hop on one foot like this in one place. Now switch feet. And now with both feet. Perfect. I want to thank you for being my patient today.